Hello everyone, welcome back to my channel. Today it's 6th January and as per our schedule it's the second topic which I'm going to discuss with you people, and the topic is on surgery, the post-operative care and surgery, which is both in practical and theory. And to remember that easily, because we remember what is given in post-operative care even in layman term, but we don't remember the exact format how it is monitored. So there's a short mnemonic fast hug BID which is being used and to make you people retain it very nicely. For F it comes nutrition. The first of all, the patient after the surgery is kept nil parolar for 6 hours, and then they started on the liquid diet, then soft diet, then semi solid diet, and so on. If the patient is very severely ill in ICU, then the patient started on total parenteral nutrition. Okay, and fluid and electrolyte balance, intake and output chart is to be maintained to check what amount of electrolyte disturbances is seen and what amount of fluid the patient has taken, and was it digested or not. In A it comes analgesia, which are given pain as a painkillers post surgery to reduce the pain which the patient did not feel under the anesthesia during the procedure. And another one is antibiotics. It's given both preoperatively, postoperatively, and just before the surgery as well. As per the SAP protocol, antibiotics are given to the patient. Then S is sedation. Sedation is given both at the introduction, maintenance, and to prolong the surgery. Sedation anesthetic drugs are given according to the surgeon preference and the procedure performed. And T, thromboprophylaxis, which is the most important one to prevent DVT, because the patient is lying supine and there are more chances of forming a clot in the legs. Therefore, low molecular weight heparin endopharynx is given accordingly, most preferred one. And HCA we have other comorbid conditions like hypertension, diabetes mellitus, thyroid, bronchial asthma. They are the mainly comorbid conditions seen in Indian population. There are many other as well. And you say it's come ulcers. Ulceroprotective drugs are as well started because we are giving many of the medications, and to prevent any mucosal damage and acidity and acid reflux, we give ulceroprotective drugs as well. PPIs we give mostly. And then for G, glycemic control is as the India is the diabetic capital, we have to check for diabetic control in the patient, both the post operative sessions, because in post operative, if the glycemic control is not maintained, then the wound won't heal nicely. And with B, bowel and bladder movements are monitored, whether the patient has passed the flatus, whether the patient, because if the patient haven't passed the flatus or stools, then it can lead to paralytic ileus, and that is the triggering factor that the surgery was not completely healing the person. And any bladder movement, and like it is the passage of urine was done, and how much quantity of urine was passed. And with I come the informed consent about the procedure and about the cumulative risk the procedure has to the both patient, the nurse, and to the attenders, and then to the next duty doctor when handing over the patient. And D is for the drugs, the various drugs which are given along with the routine drugs which are given to the patient post surgery. Hope you like it. If you find it useful, please hit like the button.